days up till 5 p.m. on Saturday. And since that time, there have been an additional 11 cases that come in that I will only be able to speak about in detail tomorrow when we meet again. So of the 87 on our website, 29 have recovered, 14 are hospitalized, and we now have 5 deaths. We've had a death over the weekend. A man in his 70s, travel-related, who passed away on Saturday. I would like to express my condolences to the family that are grieving their loss. If we have a look at our overall profile by age, it's much the same pattern as before, with the bulk of cases being the middle years, 35 to 64, getting a larger number of older people, 65 and above. And it's certainly worth noting that all of our 5 deceased cases were in people over the age of 70. In terms of the status, 29 have recovered, 33 are in self-isolation. We have another 5 that we're calling isolation precautions. This is because we have a facility that is in outbreak, a second facility, and that is Bradford Valley in Bradford, West Gwillimbury, Ontario, where over the weekend we became informed of an outbreak, and according to our data that we've got on our website, there were 5 individuals that have been identified as cases test positive. I should say that we actually know of 10 in total now because of the lag that I spoke to. There's an additional 5 that will be on our website tomorrow. So they are under isolation on the premises, with the exception of 1 staff member who's in isolation at home, self-isolation. We have 14 cases that are hospitalized, 5 that are deceased, and 1 out of country. In terms of how they contracted their COVID infection, 37 are travel-related, 21 are close contacts of individuals in the community. We have 5 down with regards to Bradford Valley, close contacts within that long-term care facility. We've got 22 that are community acquired. An additional 2 down as community acquired. I must admit I'll have to look into exactly what that's meant to mean. And then if you look at our epidemiological curve and ignore the final 2 weeks or so when there's a lag in reporting, we ignore that because during that period of time, people will be becoming ill, seeking medical attention and getting tested, and so we can't be certain that we've got all the cases in that period of time. But otherwise, if you look at everything leading up to it, it's an upward curve. It's very much in keeping with the transmission of this in our community, increasing cases, the surge that we've been concerned is coming, and my message always is that people need to exercise the physical distancing recommendations, set back 2 meters from people, carefully consider whether you really need to go out, limit the number of times that you go out, focus on essential things that need to be done, such as shopping for food or medications. If you're going out for physical activity, keeping that 2 meter setback from other people, hand washing, and if you develop symptoms, you need to be indoors in your home in isolation for 14 days. And even if this is just very mild symptoms, this infection can manifest as being mild in some people or even asymptomatic. And so it's really important that you isolate yourself for a 14-day period. this is our opportunity, as I always say, to flatten the curve. The more of this, the better that we do this. The less that surge will be, the less likely we are to see our system, our healthcare system, overloaded as we proceed through the month of April. I think April is a very key month for us in this outbreak. This is the month in which we're going to see the extent to which the surge occurs. So if we're very successful, it'll be a limited surge. If we're less successful, it'll be a bigger surge, more likely to overwhelm our healthcare system. I've spoken about Bradford Valley, the outbreak that we have there. I would also draw your attention back to the outbreak at Spencer House in Orillia. As I'd indicated on last week, we had an individual who had been working there whilst contagious, and we were and are concerned about the potential for spread in that facility. And on Friday indicated that there were quite a few staff who were being investigated as possible cases, and that there were 2 deaths among residents that were under investigation and 2 other residents who were being tested. So we do have some good news here in that we've had no positive tests come back from any of those investigations. We've had quite a few negative tests come back to date. We're waiting for 2 more tests. The 2 individuals have passed away upon consideration of their situation, had underlying medical conditions that would explain why they passed away. So if we're very fortunate, there won't be any evidence of other individuals becoming infected, but we are following both of these outbreaks very, very closely. There are the outbreak control measures in place, staff wearing masks, the prohibition of others coming into the premises, cases being isolated. If you talk about Bradford Valley, the cases are isolated from others in the facility. Intense surveillance and testing of any individuals that manifest with symptoms. If you look at our cases that have occurred since Friday, just to go through some of the details, as I said, there's beyond the total of 87 cases, there are an additional 11 that we'll have more information for you on tomorrow. So if you look at the 16 cases that occurred since I last reported on Friday, we've had 5 in the long-term care facility. We've had 4 that are hospitalized. We have 6 that are in self-isolation. 4 of these cases have been travel-related. 6 of them have been close contacts of confirmed cases. And of them all, we have 2 that are in Muskoka, and both of those are hospitalized at the Muskoka Algonquin Hospital Corporation. I'm going to go through a few key messages for you. As always, I emphasize the importance of compliance with the physical distancing, the self-isolation for those who are symptomatic or have returned from travel out of country. We still have travel-related cases happening. There are still people coming from out of country, and those people must, under the Federal Quarantine Act, go into self-isolation in their home for 14 days, and if they develop any symptoms, to stay in self-isolation 14 days after the onset of their symptoms. And if they fall into certain high-risk groups, then they really require testing as well, going to an assessment center, or if symptoms become severe, such as shortness of breath, going to the emergency department. So healthcare workers are certainly individuals who should be tested if they develop symptoms. And people who work in long-term care facilities are people who live in remote communities or people from indigenous communities. There's a lot of question now, I think, about masks and masks used in public. And Dr. Theresa Tam, the Chief Public Health Officer of Canada, has indicated that what's really important is that people do their physical distancing and their hand washing and the 2 meter setback, staying at home if you can. Certainly if you're ill, staying home for the 14 days. She indicated, though, that individuals may want to wear a mask if they're in situations where they can't socially distance, they can't physically distance the 2 meters. And by masks, we're really talking about homemade cloth masks, not hospital masks, surgical masks, procedure masks, N95 masks for healthcare workers. All of those, at this time, we really need to retain for healthcare workers because of a limited supply of masks for healthcare workers at this time. They need those masks. So if people are using other masks, homemade cloth masks, they should be aware that they're not of proven value. If there is any value in them, it's more from the point of view of avoiding infecting others. If you wear one of these masks, there's the potential for droplets from you and from coughing and sneezing from you affecting other people, keeping in mind that if you're coughing and sneezing, you really need to be self-isolating at home. So the potential value of a mask is more the prevention of spread to other people. They've not been shown to really prevent respiratory viruses from coming into your airway. And there's also the potential for complacency. If you wear these masks, you might get a sense of reassurance that's not warranted, and also the potential for you to be touching your face or touching the mask and then contaminating your hands, and then there's a potential for spread, touching your eyes, or spread to other people, touching surfaces. After that, they could spread to other people. At this time, those who have challenges getting food under normal circumstances, people with food insecurity, I think would be particularly challenged now. All of us, I think, have some challenges in going shopping. There's lines in order to get into grocery stores because they're abiding by the limits of the number of people that need to be on the premises and about the spacing that people need. So those who have issues of food affordability be all the more challenged. And I understand that food banks need everybody's support and are accepting donations, so the federal government is providing more funds to assist with that. And there's also the need to help people who can't go out and shop because they feel vulnerable, particularly those above the age of 70. The Chief Medical Officer of Health for the province, Dr. David Williams, has recommended that people above 70 self-isolate, that they not go out. And for them to actually do this, they really need assistance in being able to get their food and get their medications. There's 2-on-1, there's ordering online, but I understand there can be a lag before people can get those services, so it may come down to family and friends helping them out in a way that still allows for that 2 meter setback when you're helping them out. People might be interested in knowing that Statistics Canada is doing a survey at this time, online survey, anyone can respond to it, gauging the impact that these controls are having on your health and your mental well-being. And if you want to participate in that, go to our website under COVID and you'll find a link to be able to participate in that survey. I think that kind of thing is really important for us to understand. We know that this is hard on everybody, and that the potential loneliness this causes is hard on our mental well-being, and also the restriction on activity, hard on our physical well-being. I've got a couple of questions that have come in for me to address. Yeah. One of them is a scenario that goes like this. If my father lives alone and is struggling, can he expand his safe circle, social circle, to include a couple that has been staying home as well and move back and forth between the two residents for companionship, shared meals, etc.? And I reflected on Friday that those who live alone are particularly vulnerable and hard hit by the restrictions that are now put in place and the recommendations that people keep to their household members for intimate contact and otherwise maintain physical distancing from everybody else, that's going to be very hard for somebody who lives alone, because essentially they would have nobody who's in their intimate circle. And I reflected that on Friday, that perhaps in those instances, such individuals may very well want to choose somebody else who perhaps is in the same situation that they become buddies with in this situation, that they exclusively get together with that other person, or in this scenario, another couple. And if it's exclusive, mutually exclusive, that would be probably a reasonably safe thing to do. It's not without risk, that's for sure, but in this situation, I think we're forced at times to choose trade-offs, and to me, this would be one potential strategy to deal with extreme loneliness from being utterly alone. Now I've got another one here, which refers to the cases at Bradford Valley Care Community, and I've already spoken to that situation. So at this point, I would be happy to take questions.
Okay, Chris Simon, do you have a question for Dr. Gardner?
Yes, thank you, Dr. Gardner. I'd like to on the common link between Bradford Valley and Spencer House, which is they're both owned and operated by Sienna. Do the outbreaks at these two facilities, does it have anything to do with screening practices for staff coming into the facility, or is there anything that they can be doing better, I guess, to flatten the curve and stop the spread?
Well, I'd certainly like to acknowledge that outbreaks in long-term care facilities is a critical issue for us at this time, because there's such a vulnerable population, and we've seen tragic incidents that have occurred with multiple deaths, and we need to do all that we can to protect the residents of those facilities. I'm not aware of anything that would explain that apparent coincidence or that link. You raised an important point, I think, and indeed we are looking at their practices, and at this time looking very closely or immediately at what needs to happen to control the environment and prevent the spread. I would like to emphasize that Spencer House, although they had the one exposure with the one staff, as yet we've not had any evidence of transmission in that facility, so that's a good thing. And I think we need to continue to work with all of our long-term care facilities about their practices at this time, including the use of masks. We're now advising masks be used by healthcare workers and those who work in healthcare environments at all times while they're in that work environment. That needs to be done in a way that conserves masks, because there's a shortage of masks, but this is something that the Simcoe Muskoka Health Unit is promoting to the healthcare facilities in our district, and that also includes long-term care facilities.
You have a follow-up question, Chris?
Yes, Dr. Gardner, can you talk a little bit about the deceased person? I'm guessing that is case number 77. And did they have any underlying complications that made the contraction of the virus any worse?
So they had some pre-existing medical conditions. That man did travel, went to Ecuador. Is older, above the age of 70, so had the exposure through travel and two risk factors, age and pre-existing medical conditions.
And sorry, you said he died over the weekend. Was that Saturday or Sunday?
On Saturday.
Thank you.
Okay, Erica, do you have a question?
Yes, I do, please. What hospital was the Wasaga man at, and how long was he there for?
Sorry, just
Oh, that's okay.
checking that out. If there's, just remind people to mute your lines if you could, please. So once again, you were referring to the deceased individual, right?
Yes.
Yeah. And he was... He was admitted late in March, and then passed away on Saturday.
At what hospital?
At the Collingwood General Marine Hospital.
And have there been any cases that you have to follow up with staff from CGMA?
No, precautions were taken. There weren't exposures related to the work site, to the hospital site.
Dana, do you have a question?
Yes, I do. Apologies if this was already mentioned, but just wondering how the outbreak actually, or the virus came into the Bradford long-term care home in the first place.
At this point, I don't have clear information as to exactly how it happened. What happens most commonly is a staff-related exposure because, in fact, nobody else can come into the facilities but staff.
Right. And then just to clarify, did you say that there were 11 new additional cases that came in today? I know you can't talk about them, but
Yeah.
that would bring the number up to 98 total cases, correct?
That is correct. They came in actually after 5 o'clock on Saturday. As I indicated that we have reduced staffing over the weekend, so on the weekend we place our cutoff at that point.
Okay, so 98 total cases, and
Yeah.
10 are in the Bradford long-term care home?
Yes,
Okay, and then the 9 are in residence and 1 is in a staffer.
that is correct.
Okay, thank you.
Doug Cross, do you have a question?
Yeah, I was just wondering, I've had gone through this process for a few weeks now, Dr. Gardner. Is there anything that you think is going well in terms of how you're managing the health units and all that's going on, and maybe on the other side, things that are troubling you?
I'll start with the troubling. I'm troubled about community transmission and acutely aware of our task, both the health units and the whole community, of flattening the curve through social, physical distancing. It's really up to us all to flatten the curve. So that is troubling, and that's my key message that I don't think I can say too much. As a health unit, we've moved into a new normal, I would say. Most of our staff are deployed now to the response. We've settled into cycles, such as the media cycle, information gathering and preparation for the media, development of our website with the information that the public needs and the media needs about what's happening and how to protect yourselves. Staff who've had to take on completely different roles, having adapted well to that. And although we continue to have a significant number of cases, they haven't accelerated as yet. There's still certainly an upward trajectory of cases, but the numbers of cases day by day is not rapidly growing, which gives me hope that we are actually having an impact in flattening the curve. It gives me some reason to believe that we are moving in the right direction to avoid an explosion of cases that would overtake our healthcare system. I do contemplate to the future and the tasks we will need to do. This is going to be a long, long task. We will be weeks to months bringing it under control, and I believe probably beyond a year up to 2 years before we get a vaccine and can protect the population to prevent recurrence of waves of this virus coming through. So we need as an agency to move into a longer phase where we can sustain that well, and hopefully in the not distant future be able to repatriate some of our staff back to our other programming so that we can continue to protect people from food safety incidents related to restaurants or other vaccine preventable diseases, or do our tobacco enforcement to protect youth from tobacco or vaping. Those are things that have all been curtailed, and so my concern is that we need to move, given that this will be with us a long time, move back into being able to do those things certainly at a higher level than we're doing right now.
Perfect. And follow up about focus cases for cases that are hospitalized, where are they? And if you said it, I apologize to someone in my ear.
Okay. So,
just the most recent.
yes, I understand. So we have one that is at South Lake Regional Health Center. We have one that two that are at Muskoka Algonquin Hospital Corporation, and we have one that is at Stevenson Memorial Hospital.
Okay, so I guess you can't just say the most recent two because that is too identifiable.
I'm sorry, what was your question?
Just the two most recent cases you announced today when the hospital there ran 54, was there 4 new cases?
Yes, so as I said, there's one's at Stevenson Memorial, one died at Collingwood General Marine Hospital, one is at South Lake Regional Hospital. We have 2 that are at Muskoka Algonquin Hospital Corporation.
All right, thank you very much.
Okay.
Okay, thanks, Stephanie. Did Schubert, do you have a question?
Yes, I do. Good afternoon. Doctor, I just wanted to ask you about, according to Premier Ford, we're going to be running out of PPE in 1 week. Can you confirm the situation of protective equipment right now?
So I've not actually heard the 1 week quote, but indeed we are in a very difficult situation with regards to personal protective equipment, including masks for healthcare workers. The province is well aware of this. I understand that they're doing all they can to procure more. I'm aware that there's also the desire to look at saving masks, reprocessing them, sterilizing them, and reusing them. There's a conservation approach with masks so that they're being used in ways that they weren't before. The idea of wearing a single mask throughout an entire shift rather than in the past putting them on and taking them off for patients and procedures that required it, and therefore going through multiple masks is being stopped, and instead moving in the direction of this conservation approach. But indeed, it is a very worrisome situation because we absolutely need to both protect our healthcare workers in the work environment, and that means making sure they have masks, and also protect patients because asymptomatic transmission from people who don't have symptoms is part of what's happening with this virus, and so there's a potential indeed for healthcare workers to inadvertently cause infection in patients, or for that matter residents of long-term care facilities. That's another very good reason for having personal protective equipment on as a healthcare worker. It's a worrisome situation indeed.
Say a person goes out in public with a mask, what is the typical life cycle of a mask? How long should people be in possession of just one before switching on to another?
So we're not recommending that people use healthcare masks in public. We're recommending that they be conserved and reserved for healthcare providers in healthcare environments. The Chief Public Health Officer of Canada has just recommended that if people are in the community and are in situations where they cannot socially isolate, they're crowded and they can't get away from that, that they might consider using a homemade cloth mask. But she'd also identify that there's a downside to them. They can't in any way guarantee that the wearer is protected. They haven't been shown to be effective for that. They might reduce transmission from the wearer to other people. And there's the potential for the wearer to contaminate their hands by touching the mask in the face and then touching other surfaces that could lead to others becoming infected, or touching their eyes, leading to themselves becoming infected. Really the whole idea of wearing a mask in public is not at all clear to be a good idea at this time.
Thank you.
James Fuller? James, are you there? You might be on mute. Okay, we'll come back to James. How about Craig Momney? Are you there, Craig? Oh, okay, let's go to Mandy.
No questions for me today, thank you.
Okay, Natasha?
Hi, just a question about the Bradford Valley. The worker there, do you know if there's any other homes impacted by this? Like, is he working at any other care facilities in the area?
No, we don't believe that that individual was working in another premise.
Follow-up question, Natasha?
No, just that one, thank you.
Okay, thank you. Nathan Taylor, are you there?
Yes, thanks for taking the call. I just wanted to clarify, I wanted to make sure I heard you right, Dr. Gardner. Did you say that you were still awaiting 2 test results from Spencer House?
We are.
And are those tests that have been done on residents, staff, or both?
I don't have that information in front of me, so I'm not sure.
Okay. And a follow-up, you previously said that the health unit was going to conduct a site visit at Spencer House. Has that been done? And if so, what did that entail, and what were the findings or results?
So I don't know if my staff have actually gone on site or not. Certainly they've been in contact and following very closely what's happening there, but I don't know if they've actually been on site.
Okay. Adrian, do you have a question?
No, I'm okay today.
Okay, I'll just cycle back. James Buller, are you there? Craig Momney, are you there? And did I miss anyone?
Hi, it's Iris Farmer from Muskoka Post. Can I just ask a quick question?
Sure.
Dr. Gardner, the 2 patients that are hospitalized in Muskoka, which hospital are they in Bracebridge or Huntsville? Can you clarify that?
I don't have that information. As you know, they're both one hospital corporation, but I don't know which site.
Thank you.
Is there anyone else we missed? Okay. Well, if that's all for today, we will sign off and we will see you tomorrow.
Thank you very much. I have one more
Thank you,
question.
everyone.
I'm still here.
Yeah, sorry, it's Nathan Taylor. I just had one other question. I think it was asked by Natasha, but I wanted to ask about the case related to Spencer House. The one worker who did test positive, did that person work also at any other home?
Not to our knowledge.
Okay, thank you.
Thank you.
Okay. Thank you, everyone.
Bye-bye.